morning and welcome to the program Perspectives. Perspectives this morning on Invicta 98.9. And this morning, like every other Thursday, it's a day set aside for the Ministry of Health, Kaduna State Ministry of Health. And what's it that we talk about? On a day like this, we talk about COVID-19, or coronavirus, as some people would say. And of course, talk about how well we are doing with it in Nigeria, back home in Kaduna State. And of course, we know that this is also a global issue. So we'll be talking about it, how far we've come in Kaduna State, and what government is doing and expecting citizens to do too on COVID-19. For reality, COVID-19 is real. It is real, and it is still with us. And so the protocols, in place for us to observe, to stay safe, are all still there. And so we'll be talking about it and issues that you would want to raise, what's happening in your neighborhood, and what are your concerns too. That's what we do on a day like this, Thursday, where Kaduna State Ministry of Health is bringing this program to you. With me as guests on the program this morning, I have Dr. Joseph Megari, who is the Director General of Kaduna State Bureau for Substance Abuse Prevention and Treatment, and also a team member of the Emergency Operation Center. Together, we'll be doing the talk on COVID-19 here with us. And also joined with him is the Special Assistant to the DG, Kaduna State Bureau for Substance Abuse Prevention and Treatment, and that's talking about Dr. Rebecca Ekochin. Dr. Rebecca, good morning. Glad to have you too.
Good morning, sir.
And Dr. Megari, we're glad to have you too.
Good morning.
All right.
Yes.
Okay. Well, Doctor, COVID-19, we've let off our guard, as some people say. And is this still real with us? And just why? After the lockdown, why we've just gone, we're living our lives like nothing is happening to us?
Well, COVID-19 is still very much around with us, as the numbers have suggested. The numbers, even though nationally, in our state, the numbers is going down, but nationally, numbers are still really up, and this calls for attention for us to be able to know that this problem is still very much with us. Let's not forget, globally in Europe, there's another spike in the numbers. So this is a pandemic, and once there's a problem in any part of the world, then it means there's a problem in another part of the world. So we should know that COVID-19 is very much with us, and all the protocols that have been spelled out by the health authorities should be strictly followed, so that these numbers can go down and so that people can be safe. Let's not forget, COVID-19 is still a very dangerous illness, affects the respiratory system, is an infectious disease that is caused by the novel coronavirus, which affects the respiratory system, and then this can be very dangerous in some people. About 1% to 2% of people who are infected with COVID-19 will have very, very severe illness, which can be fatal. And so we don't know who will be this person, even though we have said that people who have chronic underlying medical conditions like hypertension, diabetes, heart disease, asthma can have more severe conditions. We can never tell. Even people who are apparently well can come down with very severe illness and lose their lives. And so because of this, we are calling all our people that they must obey the protocols that have been set out, so that they will be safe, so that we'll be safe. It's a public health issue. It's an issue that affects all of us and affects us individually too.
Dr. Joseph, I still say with you, we are from culture, and we are, we live our lives communally, and of course, all the things that are there about cultures, kindness to each other, respecting each other, and holding there to, our values are still there. We go for worship, as our religions would ask us to do. We also celebrate times of having births and marriages, and of course we mourn with the dead, and that brings us all together in crowds and multitude, and so that is still with us, and so our culture, as it affects and our relationships as it affects the COVID-19 with us, isn't that worrisome for you too?
Absolutely, because right now we're dealing with some balances. The balance of the threat of COVID-19 and how do we go on with our lives? How do we go on with our cultures? How do we do the things that we used to do and live our lives as near normal as possible? But we have to balance this, and this is why the protocols have taken care of all of these. When we talk about social distancing or physical distancing, this is supposed to be able to aid people not to be infected by people around them who have this virus. And then we talk about the use of face masks and the constant washing of hands. These are use of sanitizers. These are all things that have been put in place that if we obey strictly, then of course the threat of COVID-19 will have been reduced to the barest minimum.
Dr. Rebecca Ekuchi, let me come specifically to your area of specialization. You're a consultant psychiatrist in COVID-19 and how it affects us psychologically. What are the things, the signs of psychological affection of COVID-19 on us?
Okay, thank you very much. When we talk about the psychological effects of COVID-19, we will be looking at it from two perspectives. One, how the disease affects us as individuals and also as relatives of infected people, and also how the government response so far has also affected the people. Now, looking at how the disease has affected the individuals involved, the families and all that, we have there's this issue of fear and anxiety because you don't know whether your relative is going to survive, whether it's going to tip into the severe and fatal cases. So there's the issue of fear, there's the issue of anxiety, you don't know who is going to get it next and all that. Then there's also issue of depression. People are depressed due to, when you look at some of the downturn of economic activities, the effect of the lockdown on the people because of lack of money around, lack of funds, and also people are being laid off from employment and all that is causing a lot of also depression. And then we are also having cases of suicide, people who feel like they've lost hope, people who feel like they no longer have a reason to live for living, people who feel like whose business have been shut down and who feel hopeless. They also come down with psychological problem. Then we also have issues of stigma and discrimination against those who have suffered this disease. Because of our culture and the nature of our society, we tend to stigmatize people who have also survived this illness because we feel like people tend to avoid them in the community, people tend to discriminate against them, and because of this, a lot of people find it difficult to even report when they start having symptoms because they are afraid of being labeled. So these are some of the psychological effects.
Okay. Dr. Megari, reporting on cases of COVID-19 and of course testing too, has that been an issue, in the rise of this illness or disease with us?
Now, like for some reason, the form of the disease that is here with us, like it happens elsewhere, is people.
Doctor, before you go further, I'm tying this to what is happening in other parts of the world. America, an example, we're almost hitting 200,000 deaths in America today, and then back home here we're talking about just 5 cases up and 10 cases. And sometimes the question will be asked: is this a white man's disease, or not a black man's own? I want you to tie it together.
Now, the point is this: the numbers, the testing, they have more capacity for testing in the Western world, and so naturally you get higher numbers. But again, empirically, it's been observed that the deaths, the severe form and the deaths over there seem to be on the high side because for us here, even though the reports in hospitals haven't reflected those high numbers of deaths, we have also gotten those kind of mysterious deaths in the communities everywhere, even though we've had that kind of reports in states like Kano State, for example, where there were mysterious death and verbal autopsy revealed that this could have been COVID-19. For us here, there might be some factors that have modified the illness with us because, this is the tropics, and then we've been battling with malaria, and then the use of some of the suspected agents that may be effective against the coronavirus when I say suspected, they have not been proven. Like chloroquine is not been proven. And so, because of this kind of modification, we might have less severe cases here, and then we don't have, because the prediction was that we will find dead people on the streets of Africa when coronavirus finally arrives here. We haven't seen that kind of situation, and so there will be some things that are modifying, but this is not to say that with COVID-19 is not here. This is not to say that people don't die from COVID-19. Even in the Western world, America, for example, the black community suffer the most in terms of infection rate, in terms of death rates from COVID-19. So this is not a white man's illness. It's a pandemic that affects every human being. Every human being has a respiratory system, and the systems are all designed on the same architecture. And so it's an illness that can affect anyone. So we must also be careful. We do not know the person that will come down with the most severe case that can be fatal. So we must all we should all know this and be very careful, follow the protocols that have been set out by the health authorities.
And Dr. Ekochin, we are a people that for every illness, we find the available or the neighborhood doctor as one that we can go to, and sometimes we prescribe to the doctor or tell him what is wrong with us and what we want. And that's talking about, malaria symptoms and all of that. And some people would want to compare, and say that these are symptoms of malaria, and then they probably more than that. So for home treatment that we do, or the neighborhood doctor that we all go to, and exposure to COVID-19, are we seeing some differences, especially when we talk about mild illnesses that we can come down with sometimes? Do they have a link with COVID-19?
Thank you very much. Just like we know, COVID-19 can present with mild symptoms. It can go on to become severe, and it can actually become fatal. And in a situation where you can't actually predict how each person's progression will go, the progression of the disease. So that is why we advise the people that in this case, home treatment is not advised. Even when you feel like you have symptoms of malaria, because the symptoms seem alike, fever, cough, catarrh and all that, body pains, muscle pains, you shouldn't go ahead to carry on home treatment. There should actually be a high index of suspicion. Once you have fever, you have cough, you have muscle pain, don't just conclude that you're having malaria and start treating at home. And even in cases where you've taken anti-malaria from a pharmacist and all that, and you're not getting any better, you should report to the nearest laboratory or call the emergency number so that appropriate testing can be carried out to ensure that early detection is actually helpful. Those who are detected early and isolated early and treated early have better chances of surviving compared to those who stay back and just continue treating malaria repeatedly.
Dr. Joseph, you are the Director General of Kaduna State Bureau of Substance Abuse Prevention and Treatment. And Kaduna State today is battling seriously with its young ones on drug abuse and all of that. Now, let's tie COVID-19 with drug abuse. And of course, we see those involved who are, the friends of each other. And of course, all the protocols are not observed here when they do meet. So, tie COVID-19 with what is happening with, drug abuse in the state.
Thank you so much. It's a known fact that people who have medical conditions can suffer the most severe form of COVID-19. And let's not forget that the use of substances can affect the respiratory system, can affect the cardiovascular system, that's the heart and the blood vessels, can lead to the causation of diabetes, for example. So the use of these dangerous drugs, which are dangerous chemicals, can lead to medical conditions. These medical conditions will now provide the enabling environment for the most severe form of COVID-19. So people who do drugs are likely to have medical conditions that will predispose them, or that will prepare them or make them readily available for the most fatal form of COVID-19. So the relationship between COVID-19 and substance use and substance abuse is a form of cause and effect. One COVID-19, will be severe in people who abuse substances. And people who abuse substances are people who are not likely going to observe the protocols for staying safe. And so this kind of people, when they're in their jungles, will not operate, will not observe the protocols. And these are the kind of people that are likely going to contract COVID-19, because COVID-19 is spread from person to person by droplets, that is coming from the respiratory system, from the nasal cavity, from the mouth. And so once these people are close, not giving enough physical distance, then they can contract this COVID-19. And because they use substances and are likely to have some underlying medical condition, are likely to come down with the most severe form of COVID-19.
Doctor just talked about droplets, one of the issues involved with COVID-19. And we see mother to child. And I'm talking about the closeness of the mother to child and what we have in our homes, especially when it comes to downtown. And how to get the child, how safe can the child be from a mother? Yes, we may come down with COVID-19. So I'm talking about the newborn child.
Okay, yes, thank you. Even though it's advocated that there should be bonding between the mother and the child and the newborn, let's not forget, one of the protocols is that of the use of face masks and proper use of it. This can help a lot, because these droplets can be stopped by these face masks, and so because of this, there is a chance that if the mother uses face mask properly, there can be protection. And don't forget that in this case of when the mother is down with COVID-19 that is confirmed, she can express the breast milk, or express breastfeeding. Breast milk can be expressed into a cup, and then with spoon can be administered to the child. So the child necessarily doesn't have to make contact with the mother. Don't forget that from the point of infection to when the clinical symptoms will be like for 2 weeks, and then if the individual comes down, the cause of the illness may go for another 2 weeks, and within that period of time, if the mother recovers, she is confirmed negative, she continues to observe the protocol of most of the face masks, and this can help a lot. But at the point where she has proven clinical case, the breast milk can be expressed and be administered to the baby. There will be no loss for the baby as far as feeding is concerned if express breastfeeding, breast milk is administered to the child. The child will still get all the benefits of that he will get as if he or she was breastfeeding directly.
Dr. Egochin, we have a situation, it's all over the country, but back home in Kaduna, we're still with it, and that's talking about having our schools reopened for full-time, schooling activities. For now, what we see around, some people say we've seen what happened in other times where schools were opened and of course had to be shut down again. For Kaduna State, and looking at us, from the global angle, having our schools opened at this time, and of course knowing the situation in our schools, how advisable would that be to have it, yes, as soon as we can?
Okay, thank you very much. Talking about opening our schools right now is actually a very dicey situation, and because we have to create a balance between being able to ensure that these schools are able to put into place the needed guidelines and protocols to make sure that these children will be safe when they get back to school. And that is why the Kaduna State government is working closely with the schools, the proprietors, the private schools, the public schools, to ensure that all the needed guidelines, health guidelines, are met first before reopening. Because when you look at the fact that generally in our society now, even the use of face masks is dropping. So how much more when it has to do with children enforcing it? So before we can do that, we have to ensure that all the safety guidelines have been met by the schools before we can advise that.
Okay, and looking at family, I want to come to family now, which is points where we make contacts and all. And again, looking at how we live, the economic situation, and of course, how we live. From family, at the home, what are we telling ourselves, mother to child, father to child, and all of that? Are we getting this discipline of observing the protocols on with the family?
Thank you very much. Talking about the family, of course, we have to keep reiterating it every day to the children and then also to other members of our household that even though the lockdown has been eased, COVID-19 is still very much around. So we still have to keep maintaining the health protocols and guidelines. We have to, as much as possible, avoid social gatherings, avoid large gatherings, go out only when it is absolutely necessary. And also for mothers and parents that have to go out to, of course, to get their means of sources of livelihood, you have to find additional ways of protecting your children by making sure that you go out with your face mask. And then even when you come back, you make sure you wash your hands and also you sanitize your hands, and also the clothing that you wear, that you wore outside, when you come in, you should have a particular place where you keep it outside before you have to start embracing your children or carrying out all of your other household activities. We also have to start sensitizing and educating these children. If we are talking about getting them back to school, they have to get used to the use of face mask. They have to get used to being able to maintain physical distance of about 6 feet at least from others. They have to get used to washing their hands with running water and soap for at least 20 seconds. They have to get used to using hand sanitizers. And of course, the issue of diet, we must also consider that, because the better and the more balanced your diet is, the greater your immunity and the more strengthened you are to fight the infection. So we also have to make sure we eat immune boosting food and also get our diet balanced as a family.
Dr. Megeri, just listening to Dr. Ikuchin, I said this may be a tall order with the way we live and our population and of course going to the hinterland and how we live our lives. But again, tall order as it may seem, these are things that we must do. Discrimination and what we've found out from the after effects of COVID-19, how we treat them, how we ever look at people with COVID-19 and bringing them back to society. People are afraid to talk about it because of such discriminations that may come on them. What are we saying with the reality of COVID-19 to say that yes, people can be treated and are certified well from treatment?
Thank you. I think it is very important for us to know that COVID-19 is not a death sentence, and it's just an infection. And let's not forget that about 80 to 90% of people who have COVID-19 will not come down with severe symptoms. Only about 1 to 2%. And so some of the people who are even discriminating against other people may have even had COVID-19 infection that was asymptomatic. So there's no point to discriminate against someone who has had COVID-19 because it's actually not useful at all. It is born out of fear, just fear. And anything that you fear, then there's a likelihood of discriminating against, because that's when you try to stigmatize that thing. And so it is a lack of knowledge. So people who discriminate against other people are doing it from the point of lack of knowledge, because if you know what COVID-19 is, it's not something to discriminate. It's not it's not something that you should discriminate individuals for. So the words that comes readily to mind is that we must all take responsibility as individuals to protect ourselves and to protect society, not to discriminate against people, because discriminating against people will make them not to come out to report. And so once they don't come out to report, they're going to remain in the community and infect other people, and nobody knows who is going to be infected next. It could be your son or your daughter or your mother or your father. And so if you fuel behaviors that will lead to stigmatization and will make people not to come out, you are also endangering your own health, because anything that has to do with public health is a thing that we must take collective responsibility to be able to push back, because if we don't push back, then we are all at risk of this very dangerous illness. If you survive it, your relative may not survive it. Your son may not survive it. Your daughter may not survive it. The numbers are very sobering. If you look at the numbers in Nigeria as it stands today, about 57,724 individuals have had confirmed cases. So that's to say these are the people who have been tested in the laboratory. And let's not forget that our testing capacity is still not optimal. And so we miss a lot of people because they are not being tested. With deaths of over 1,000 people, 1,102 people have died so far, in Nigeria. And it's a very sobering number for us to joke or play with. So we should not discriminate against people because we put ourselves to danger. It's about what goes around comes around. And so we encourage everybody not to discriminate. These individuals have not, it's just an illness, it's just an infection that they have had. So they should be encouraged so that they will come out and get the kind of help they should get, and so protect every one of us.
All right, the program is Perspectives this morning, and it's a program sponsored by the Kaduna State Ministry of Health, and we're talking here about COVID-19, the reality of it, and of course, it is real and still with us. Dr. Joseph Megari, the Director General of Kaduna State Bureau for Substance Abuse Prevention and Treatment, here with us in the studios, and with him is Dr. Rebecca Ekuchin, Consultant Psychiatrist and Special Assistant to the DG, also with us. We'll go for a break. When we come back from this break, we'll be getting ready to have our lines open to hear you out there. Welcome back. It's the program Perspectives this morning, and this morning's program is sponsored by the Kaduna State Ministry of Health, and we are talking about COVID-19 with us. And Dr. Joseph Megari, the Director General of Kaduna State Bureau for Substance Abuse Prevention and Treatment, our guest this morning. Also with him is Dr. Rebecca Ekuchin, Consultant Psychiatrist, Special Assistant to the DG, also in the studios with us. Dr. Ekuchin, I want to pick from the last conversation with Dr. Megari on fear of COVID-19. It is a psychological thing, and so COVID-19 and fear. Where do we get the fears, around COVID-19?
Okay, thank you very much. A lot of the fear over COVID-19 actually comes from the misconceptions people have had, and also the role social media has played in also disseminating wrong information without actually confirming them. So these are some of the sources of the fear that we have, and also of course the fear of the outcome, the fear of what we see and read every day, what we watch on the television. These are some of the things that have been creating fear and also anxiety in the mind of the people.
Okay, Dr. Joseph, I'll get to the people now, but I want special attention now on what the state government has done, on COVID-19. We'll go back to when it all started, the lockdown, and the Kaduna State government was on top of it, and so much, reference was put on Kaduna State on how it is tackling the issue of COVID-19. But now we are told that we are all on our own now. So are we talking about relaxation, of what government would do or should do on COVID-19 now that we are on our own?
Thank you so much for that question. The Kaduna State government has done very well in, fighting back COVID-19, and it's been recognized in the country as one state. Don't forget, we have a very active governor, the president of Malam Nasir Ahmed El-Rufai, very proactive, and his deputy is a public health physician. He's a consultant public health physician, and the team of the Emergency Operation Center is full of very erudite public health specialists and specialists in different fields of medicine. And so the response has been very robust from the beginning, and it is still robust, as it were, because moving from when COVID-19 started to this moment, we have about 4 labs that can carry out tests for COVID-19 within the state. When we started, There was no lab that could do this. Now we have labs that is spread across the state that can carry out this kind of testing for COVID-19. So there's a lot of improvement. Don't forget that even the isolation centers have been opened across the state. In Zaria, in Kaduna, in Kavanchan, the infectious disease center at Kakuri is working very assiduously to be able to treat individuals who come down with confirmed cases and are symptomatic and who have symptoms. So Kaduna State government has done so well and is doing more to tackle the problem of COVID-19. Government has tried as much as possible to balance, between the public health measures that that have been put in place to protect citizens and balance them with we know the government knows that there will be some effect on individuals who go out daily to source their means of livelihood. So that is why the government is working that kind of very tight road in trying to say, okay, we cannot go to keep people at home endlessly. Take responsibility, go out, follow the protocols, the social distancing, physical distancing, wash your hands regularly, use alcohol-based sanitizer. Don't gather in crowds. If you must go to, eventually people go to places of worship, but they must maintain physical distancing. These are the protocols that have been put in place. It's not as if the government have left people on their own. The government is now saying, okay, we cannot go to keep you at home endlessly. Can you take some responsibility so that you are safe while you are trying to fend for your own livelihood, so that in trying to protect you, hunger does not kill you before COVID-19 reaches you. So the government is striking a balance, and so people must understand this very important step that government has taken. And government, Kaduna State government, has received applause around the world for its reaction, for its response to COVID-19, and we must keep that tempo. And then we're enlisting the entire citizenry of Kaduna State that they should take responsibility so that we will all continue to be safe. And we're also from calling on the people that COVID-19 and the stay-at-home order and the lockdown and all of this is not an excuse to slip into taking drugs. Drugs will make one have the most severe form of COVID-19 if eventually gets it. So we are calling on all people to eschew the use of drugs, because the use of drugs will put your physical health, will put your psychological health, will put your social well-being in jeopardy. We do not want you to put yourself on harm's way by using drugs. If you use drugs, let's not forget, drugs is a pandemic already. It's a big epidemic that we're dealing with, because the global figure is about 5.6% of the world population use drugs. In Nigeria, it is 14.4%. So we are about 3 times higher than the global average. So if we use drugs, it's already a big problem that we have in our hands. And then post COVID-19, it is what Fela will refer to as double wahala for dead body. So I will call on everyone to avoid the use of drugs. Drugs will do you no good in any way. Drugs will only put your health, your lungs, your heart, your kidney, your intestine, your skin, your brain into danger. It can make you go mad and walk on the street naked and eat from dustbin. Avoid the use of these dangerous drugs, because they will pull you down socially. If you were high before, it will take you to the bottomless pit of society. Avoid the use of drugs. Young people, if you have not started using drugs, don't experiment. If you have ever seen Fadama or rice farmland, if you have ever worked in it, if you are trying to go out of it, as you move from the other leg up, the other leg will sink. That is how the use of drugs is. Don't get into it. It is in drugs that the saying prevention is better than cure comes very clear. If you avoid the use of drugs, you are better, because you will not benefit anything. But if you start, everyone will treat you. If you are not careful, after the treatment, you can still have some things that are left, some madness. You should avoid getting mad, young people. Avoid it avoid the use of drugs, because drugs will kill. It will end all dreams. It will make your life you'll be miserable. You will not be useful to society. And if you get COVID-19, that is double death, double wahala for dead body. So avoid the use of drugs.
Okay, that's coming from Dr. Joseph Migari, DG, that's Director General of Kaduna State Bureau for Substance Abuse Prevention and Treatment. And also with us in the studio is Dr. Rebecca Ekuchin, Consultant Psychiatrist, Special Assistant to the DG. With us here too. Time we come to you and be part of this conversation. What's happening in your neighborhood? For you, is coronavirus real? World over, we know it is real. Play your part is what we're asking. Keep safe, and that's what this message is all about. Time we take your calls, your questions, comments. Let's get to hear them on numbers 081 40,000 989, 081 40,000 989, or 070 87 800 989, 070 87 800 989. Your calls now. Hello, good morning.
Good morning, Mr. Chairman.
Good morning. Yes, could you stay away from...
Good morning to your guest.
Yes, okay.
Good morning, thank you.
Chief Amotekun, okay.
Yes, Chief Amotekun.
All right.
My question goes to the doctor.
Doctors.
They say COVID-19, COVID-19. This is what the government is using. You might need to understand it. Both the professionals and the government, they are just using it to deceive many Nigerians.
Did you say that? Chief Amotekun. Chief Amotekun, did you say that?
I'm with you. I said, from my own perspective, the way I'm looking at this COVID-19 in Nigeria, they handle, the way they are handling this issue in Nigeria is not fair. Let me tell you something. They said no treatment, no syrup, no tablet. But you waiting to be millions and millions of naira being used for the treatment. What did they buy? Now that case, I do not pure water, I do not ginger. That's why I'm saying, from my own perspective, I'm looking at it as a means of deceiving Nigeria. Still, Mr. Kenalabi, we need to tell ourselves the truth. I'm not a medical doctor, but on my own belief, by the special grace of God I serve, that COVID-19 is not meant for me, and it's not meant for my entire family. And that's the thing I wish to every Nigerian. But what we need, as your medical doctor is here now, telling us what the government has been doing, and we are not seeing it. I don't think this thing is on the air, on the ground, where eyes can never see, where ears can never hear. Are we blind?
Okay, Chief Amotekun. Chief Amotekun.
Let me complete.
No.
Come to General Hospital at Wamboro here. You will not see any facility, and they are telling us the government has done this. Are they doing it in your household?
Chief Amotekun. Okay, let's address your question. Dr. Megari, two things coming out here. Reality of COVID-19, government not doing anything, and believability of COVID-19, and tying it to God. You know, as he has said that, no, in God's name, he will not come near COVID-19. How do you address that?
Oh, thank you so much. Thank you, Chief Amotekun, for raising up your observation. You haven't seen plenty of COVID-19 cases because the government has done so much that it has prevented people from, so many people from coming down COVID-19. Some individuals have actually had COVID-19. They've said this, the test has confirmed this. So people have even lost their lives. And this is not contestable. The late Chief of Staff to the President fell from the illness of COVID-19. It was publicized. So if you follow the news, you have this information. The Americans, over 100,000 deaths have been recorded. This is from COVID-19. They will not say that to make anyone happy here in Africa. So these are facts, and the numbers are there. They are genuine numbers. They are facts. You must separate facts from myths, and that's why we are in this program, to get the facts straight to people that COVID-19 is real. People are coming down with COVID-19. People are dying from COVID-19. You must take it seriously. Even the God that we all serve has encouraged us to listen to the authorities, to the people who are in government, who are empower us so that they can guide us aright, and we should also pray for them. So I think we're all working together with the religious leaders and with the government to make sure that these numbers stay very low, because if we want to wait until the numbers get very high and we want to see people on the street, we will be overwhelmed. Our health system will be overwhelmed, and then those people that you haven't seen, you see a lot of them, and your own health will also be put in harm's way. And so that's why government doesn't want us to get to that level, and they're doing so much to prevent. Prevention is cheaper and better than cure. I always describe prevention to be this: we believe in God. If an accident doesn't happen, because God has protected you, you will not know the intensity of the problem that you are safe from. If it happened, it would have been, if it had been the other way around. So if you don't see darkness, you will not value light. So it's only when you see darkness that you value light. So we should not wait until we see darkness before we value light. Light is here. We should follow government protocol. COVID-19 is real, and we must do everything to take responsibility and avoid COVID-19. Government has done so well. That hospital you talk about, I've been to that hospital, and I know that if you enter the hospital, towards your right, towards just to the right, where the consultation for outpatients taking place, there's a place there where samples are taken, and then these samples are transported to the testing laboratories, which are not everywhere, so that we get the results. So the government is doing a lot. Government is doing so much to prevent. The thing with prevention is that because it has not happened, you won't appreciate it in concrete terms, because it has been prevented. You understand? So if somebody had the prevention from an illness or was treated, he will only appreciate the enormity of the illness if he has gone through treatment. If somebody has gone through a ventilator, pray for nobody to go through that. Then the person, when it comes, will tell you that COVID-19 is a serious thing. So also pray that we stay protected from COVID-19.
Okay, we still can squeeze in this call. Hello, good morning. Good morning.
Good morning, Grace. Good morning, doctor.
Good morning.
My name is Sunday, Nigeria. I want to ask the doctor, in Kaduna State here, which hospital that are doing the test of coronavirus? Second, which drugs are they using in coronavirus? Third, if there's a drug, if they cure you, if they cure the patient, is it going to contact after the curement, is it going to contact the coronavirus again? Thank you.
Dr. Ekuchin, can you start with that? That's it.
Okay, thank you very much, Mr. Sunday, for that, for those questions. We have a couple of testing centers. We also have isolation centers, and we have quarantine centers. One of our isolation centers is at Hamdallah Hotel for majorly people who are asymptomatic and who have mild cases. Talking about treatment, researches are still ongoing to actually get a confirmed treatment for COVID-19, and also scientists are working hard to try and get a vaccine that can help in preventing COVID-19. So for now, basically, what we do what we call supportive treatment. We treat basically the symptoms in the centers. Some have talked about use of chloroquine. We use or even antibiotics and some other medications to treat patients who are symptomatic. And then even after treatment, there is no confirmed study to show that the patient can still get reinfected. It's still an ongoing thing. This is actually a controversial issue, whether the patient can still get reinfected after completing a treatment and becoming a confirmed negative.
Okay, Dr. Magedi, can we see it and link it up with get treated for, I come down with malaria and get treated for it, I'm free of it. But we do the same things. The mosquitoes don't go, they stay with us. And so treatment, and keep going back for treatment again.
Thank you so much. COVID-19 is a novel virus. That's to say, it's a virus that hitherto has not been known infect humans. So much is unknown about this new virus. So a lot of research is going on around the world to be able to help us, validate various, whether there are treatment protocols or guidelines or whatever it is that will be used to treat these individuals. So that is why the issue of prevention is very key. If you don't have, we are the medical experts. We are telling you that we are not sure of what ways to treat, because treatment is basically symptomatic, just like my colleague has said. We are telling you, so the easiest and better thing to do is to protect yourself, to prevent this thing, and that is why everything, all resources, all hands must be on deck, like Kaduna State government has done, to ensure that people are protected from COVID-19. Because if you are infected, you can never tell what course you are going to follow. So the cheapest and better thing for you is to avoid it by making sure you take all the preventive measures. Like Mr. Moteku, we encourage you to take all the measures to protect yourself and your family and your loved ones from COVID-19, because it is a dangerous illness. I will not want you to have a taste of it to believe it. So avoid it, prevent yourself, and don't have the sequelae of having a COVID-19 infection either on you or your relatives. So follow the government protocol and you'll be better for it. So prevention is the key here. If we prevent ourselves, it is better.
Okay, and your last line, Dr. Ekuchi.
Okay, I just want to say that just like the human race has always been faced with one pandemic or the other over the years and over the ages, the same way they come and go, the same way hopefully we are hoping that COVID-19 will eventually go, hopefully, by God's grace. But for now, as long as it's still with us, we want to encourage the people, the citizens, to please try and stay safe, try and keep to the health guidelines, stay safe, and also try and be responsible for your own health and for the health of other members of the community.
And that will just be the size of it on program Perspectives today, and a program sponsored by Kaduna State Ministry of Health. Our guest this morning has been Dr. Joseph Megadi, Director General, Kaduna State Bureau for Substance Abuse Prevention and Treatment, and also Dr. Rebecca Ekuchin, Consultant Psychiatrist and Special Assistant to the DG. Thank you all for coming on the program.
Thank you so much.
Thank you very much.
Thank you for having us.
Okay, and that's about it on Perspective this morning. I'd like to thank my colleague Dashin for connecting me with you this morning, and Wisdom for putting us in the pictures with Nata with us in the studios. Good morning.
Now, are you ready to begin? Your 24-hour station, 98.9
Invicta FM.